Today, there are over 250 diabetes devices in the market, each with their own set of software visualizations, reports, or in some cases, devices without any analysis tools outside of the device itself, leaving a patient's care team to reorient and constantly adjust in order to analyze the data from the disparate manufacturer devices and systems for reports. Normally, a patient with diabetes will need to bring in their device or some form of a handwritten logbook for the clinical care team to review. This at times leads to patients showing up for appointments without their devices or incomplete records of the trends in their blood sugar readings. This presents a challenge to care teams in obtaining the detailed information to provide the best therapy. Glooko Enterprise addresses this challenge by providing an agnostic approach with a platform that is compatible with over 95% of diabetes devices available in the market today. This allows care teams to have a standardized approach in analyzing the data and viewing reports, regardless of the device manufacturer's make or model. This includes blood glucose meters, continuous glucose monitors, pumps, and diabetes smart pens. With the Glooko Enterprise platform, the patient's device data is available to the care team in between appointments through the free Glooko mobile app or in clinic via the Glooko transmitter and uploader software. This allows for a holistic view of all patient data for an efficient workflow to quickly analyze data and provide effective therapy for improved patient outcomes in managing their diabetes condition. The Glooko mobile app is free and available to download on the Apple App Store for iOS or Google Play Store for Android. The mobile app allows people living with diabetes to sync compatible blood glucose meters, continuous glucose monitors, and diabetes smart pens. In addition, people can sync with exercise trackers, log and view food for carb tracking, medications, insulin, and exercise. They can also set reminders to check blood sugar, medications, and insulin. With Glooko, a patient can bring their compatible diabetes device to their appointment. At check-in, a medical assistant can upload the device data via an in-clinic transmitter or uploader software. The clinician or care provider can then view the data in a series of visualizations and reports that provides a detailed look into the patient's condition. Information such as average, median, standard deviation, percentage time active using a CGM, highest and lowest blood sugar readings, percentage above, below, or in target range, trends for comparisons, patterns, and best days, basal and bolus units, and percentage overrides, diet and fitness if logged in the mobile app, date and time stamped history of events. Glooko allows clinicians to remotely access a wide variety of patient-generated data in one place, including diabetes devices, blood pressure, medications, and lifestyle data. This access to data, in combination with Glooko's analytics, insights, and remote care tools, allows clinicians to run RPM and telehealth programs for their diabetes patients. Glooko's population tracker provides a bird's-eye view of the provider's diabetes patient panel. At a glance, care teams can quickly view alerts related to remote syncing through the mobile app, percentages above or below range, and blood glucose flags. Care teams can also filter the population tracker by provider, care program, case management, or MIDS status. The population tracker also displays information on the patient's provider, diabetes type, care management or MIDS program, device type along with last sync, average blood glucose, CGM readings data, and so much more. Drilling down into the patient's profile provides a summary of the patient's blood glucose data and trends, quickly providing insight into the patient's management of their diabetes condition. Details such as basal and bolus units, daily doses, percentage overrides, diet and fitness, along with trends highlighting the patient's highs, lows, and best days, allows the care team to spend less time analyzing the data and more time attending to patient therapy towards improvements. In addition to the summary page, there are a series of robust overview, overlay, calendar graphs, and logbook reports that are easily converted to PDF reports. Also, with Glooko's PDF Summaries EHR integration, it allows for a seamless interface to attach the PDF to the patient's profile in the EMR. Lastly, if the patient uses the free Glooko mobile app to sync their diabetes device in the comfort of their home, the population tracker will also display this data, allowing the care team to remotely monitor how the patient is managing their diabetes in between the patient's appointments. Glooko's Population Insights is a risk stratification tool that care teams can utilize for its strategic proactive approach towards the patient care of their diabetes population. By filtering the population on at-risk criteria by diabetes type, age, average glucose, or absolute glucose level readings greater than, for example, 250 milligrams per deciliter, the care team can then quickly identify segments of the population that are in most need of care due to at-risk factors. This information empowers care teams towards patient outreach to mitigate and turn around the patient's condition in the right direction and prevent extreme adverse events such as ER admissions due to hyper or hypoglycemic reactions. This is all possible with the use of Glooko's mobile app and clinical remote patient monitoring features, allowing care teams to view how the patient is managing their diabetes in between patient appointments, and getting in front of the patient sooner if the patient's condition is trending in the wrong direction at an accelerated pace. Tie it all together. One complete solution for personalized care. Glooko Enterprise is a connected, comprehensive chronic disease management platform with advanced visualizations and reports, remote patient monitoring, full EHR integration, risk stratification tools, and mobile insulin dosing system, MIDS, for personalized care aiming to improve outcomes for people with diabetes. It is a platform that meets patients at their level of comfort with our agnostic approach to device compatibility. Glooko Enterprise also meets providers and care teams at their level of familiarity of analysis and interpretation of the data, so that they ultimately remain focused on patient therapy, spending less time figuring out devices or transitioning reporting systems, and more time with the patient towards improving care. The overall end result is improved outcomes, patient and clinical satisfaction, along with an efficient workflow for population health management. Glooko, better together.